More than a dozen Medicaid clinics and centers in our region are now better equipped to see patients with physical challenges. Chief Investigative Reporter Eric Ross revealed last year how the majority of the clinics in southern Colorado are not accessible to people with disabilities, but now we are seeing positive results.
Good afternoon. The Independence Center of Colorado Springs is working to improve access to health care for those who need it most. The center, which primarily helps people with disabilities, gave out $75,000 worth of accessible medical equipment last year, and they plan to do the same this year. A routine visit to the doctor's office can be a challenge for people with disabilities, especially those who rely on wheelchairs for mobility. The Independence Center in Colorado Springs not only took note of the problem, they decided to be part of the solution.
We decided to purchase an accessible exam table with a scale built in and also a lift so that Medicaid primary care physicians could actually examine a person who uses a wheelchair, a senior who can't just hop up on the table.
It has a scale built into it so that you don't have to try and balance on a scale to get your weight.
Doctors' offices that don't have these accessible tables often have to estimate a person's weight, which is not recommended.
A lot of times they're monitoring the weight for diabetes purposes, things like that, for weight gain, weight loss, as well as if there are any prescription meds that the patient's on. A lot of prescriptions are done based on the patient's weight.
The Independence Center also donated assistive listening devices to help the hearing impaired.
It's critical to be able to hear and understand what's going on in a doctor's office. It's hard enough to understand medical stuff.
Although some of the medical clinics have only had this equipment for a couple of months, the feedback, as you might imagine, is positive.
They come to the visit with a little more anticipation of having a good quality visit.
It feels really good to be in any kind of setting where you can see ahead of time that people have made a place and a way for you to be there.
By the time we're done, we'll have spent $150,000 upgrading medical services for people with disabilities.
All of this money is coming from the Independence Center Fund, and the CEO says this year she not only wants to expand accessibility in medical clinics, but dental offices. All the facilities that receive this equipment, by the way, were actually nominated by patients. So if you or someone you know has a disability and would like to make your primary care physician's office accessible, we walk you through how to do that on our website, KOAA.com. You'll find this story under the News 5 Investigates tab. There, we also have a link to the medical centers and clinics now equipped with these accessible exam tables, lifts, and hearing loop systems.